Hello and welcome to TV9 News. I'm your host Ashish Parekh. The second wave of Covid-19 is rising further and further, and nobody knows when the peak would be hit and also when the wave would come down. Meanwhile, one of the significant features of this particular wave is the fact that a lot of younger people are getting affected, and that naturally means that a lot of studies are being also carried out about what exactly is different this time around. Why are younger people getting affected? And when we talk about younger people, we usually talk about teenagers and people who are around the age of 10. But now, a new study which has been carried out and in fact published in the Journal of the American Medical Association, which is JAMA, reveals that COVID-19 in fact affects a lot of children. In fact, the viral load is more in children than in adults. When we talk about viral load, it means that the number of viruses that are present at a particular place. Now, this particular study analyzed children who were younger than 5 years and had mild to moderate symptoms. Now, these children had 10 to 100 times more viruses in their nose and throat compared to adults, which means that these children could actually be super spreaders. And the fact that they actually had little to no symptoms means that a lot of older people, because they're lesser than 5 years, they would be taken care of by older people. So that would mean that they would be exposed to the virus, and also they would be spreading the virus much more. Now, you might have noticed the fact that a lot of people actually don't cover their kids' face mask, and even the face masks that they're wearing are not proper, they're very loose. Care is not taken because of general notion that the younger people have much more immunity, better immunity compared to older people, so it does not really have to do anything with them. But having said that, this particular study highlights the fact that even if the kids are not at risk, which is obviously not true, even if that is assumed, they could actually spread it to the older members of the family, which puts a lot of people at risk. To speak to us more about this, to explain the science of this to us, we've got with us Dr. Shivkumar Sambargi, who's the consultant pediatrics and neonatology department at the Sakra World Hospital in Bengaluru. First of all, doctor, my question to you, of course, is what's the science behind this? How does younger generation have much more viral load compared to older people?
Children's being super spreaders has been spoken about for some time from last 1 year, and why all this topic has come into matter is there have been studies in America and South Korea where they found the virus genetic load was more there in the nose and the throat of children when compared to the adults, and this was in mild pediatric children when compared to severe COVID adult patients. So what they found out was probably this increased virus load is going to cause more droplet infections to the people who come under the vicinity of them. So children being in the home, they can spread the infection to the adults. The science behind this is still an open question because there is no scientific data still to say why there is more concentrated genetic virus load in the nose and throat of the children, and why children are having a milder infections compared to adults. So this probably would be still an open debatable question, and further research is needed for things to be done. But yeah, there has been data to say that virus load is more there in children's nose and throat, and they probably can excrete them through the droplets or so many things, and they can spread infection to the other people.
Now, does this mean that our priority of vaccination, which obviously puts children at the last, you got older people who vaccinated, and then now people between 18 and 44, and probably next age would be younger people. Do you think that also needs to be changed? Do you think younger children should actually be vaccinated now? And if that is done, how will the dosage differ for adults and younger children?
The way to tackle this is now we are getting all our people more than 18 years vaccinated. So the only susceptible people who stay is less than 18 years who can get infection of COVID. So as early as possible, if you can get vaccinated, that's the only way to stop infection to these susceptible less than 18 years and children, so that further spread can be stopped. That's why vaccination is given so much importance from all the governments of all over the world. They want to vaccinate their children and others as early as possible. But there have been trials going around in UK and US where they'll get approvals for children to be vaccinated. Now there has been a talk that more than 12 to 18 years can be vaccinated, but to get approval for the vaccines, COVID vaccines which are there in India, we need data, trials, and then approval from the government authorities to vaccinate. But I think the only long-term way to stop this infection in children is vaccination, and only vaccination.
So that was Dr. Shivkumar clearly explaining about this science and also how vaccination in children should be carried out. Do let us know what you guys think in the comment section below, and also don't forget to like, share and subscribe to TV9 News. Thanks a lot for watching.